My name is Jessica Anker. I'm a research informaticist at Weill Cornell Medical College and the director of the master's program in health informatics at Weill Cornell. I'm talking today about a project that I conducted in collaboration with a team from Memorial Sloan Kettering Cancer Center. This is called Informing, Reassuring, or Alarming, Balancing Patient Needs in the Development of a Post-Surgical Symptom Reporting System in Cancer. Across the country, we see more and more surgeries are being done as ambulatory procedures. That means the patient is in and out in the same day. They don't even spend a single night in the hospital. Patients generally like spending time at home rather than the hospital, but that does mean that they need to keep an eye on their own wound healing, their medications, and their symptoms, and they need to decide if and when they're going to seek help. If they become too alarmed by ordinary routine symptoms, they will seek help unnecessarily. But conversely, on the other hand, if they disregard serious symptoms, they might fail to catch urgent problems and end up in emergency care. So it's important to get this right. At Memorial Sloan Kettering Cancer Center, they've been piloting a system called Access, the Ambulatory Cancer Care Electronic Symptom Self-Reporting System. In this system, patients receive a brief outcomes questionnaire via the electronic portal every day for 10 days after their surgery. If they answer all of the questions with the sort of symptoms that are expected, they receive a message that everything's fine. But if they report any serious symptoms, the nurse will receive an immediate alert, and the patient will also receive an alert to call the nurse right away. So this is a little bit of feedback that patients are getting about their recovery, but we've noticed that patients really want more information. So in this particular project, the patient-reported outcomes data is being analyzed to create patient recovery trajectories, and these trajectories are being shown back to the patients with additional interpretation and feedback. We used a user-centered design cycle, as shown in this slide, to iteratively work with focus groups and individual patients and providers and caregivers, surgeons, nurses, and informaticists to refine this system in several cycles until it finally met everyone's requirements. Overall, we found that this personalized feedback was really welcomed with a great deal of enthusiasm by patients and their caregivers. The top series of questions there shows you some examples of the types of questions that patients answer each day. Initially, we created a report that had a lot of icons in it and had a lot of numbers in it. Over the course of the user-centered design, we simplified the report. We removed many of the icons which were not seen as particularly helpful by the patients. And we also downplayed some of the alerts. So the patient still receives an alert, but it doesn't look quite so alarming as shown on the right. We overall found that patients and their caregivers welcomed the concept of this kind of feedback to tell them how their post-surgical recovery was going and to help them decide when and if they needed to seek help. During this rapid cycle development process, we learned that the feedback really should be presented as a personally tailored recovery trajectory, not as if it were derived from a whole cohort of patients. We learned that we needed to provide reassurance, but we also needed to prompt people to seek help when appropriate. We did find that we had to avoid language that seemed acceptable in conversation, but was perceived as judgmental when it was written down. The big example of this was the word normal. Patients told us that they wanted to understand when their symptoms were normal, but when we wrote that down and showed it them in an electronic screen that you are normal or not normal, it really felt very judgmental, and so we changed that language to replace it with things like you're on track or your recovery is going as expected. And finally, we learned that many of the numbers were not seen as particularly helpful by the patients, and so we replaced those with what we call gist interpretation, which means an interpretation of what the meaning is. So instead of saying this side effect was reported commonly by 70% of patients, we merely told the patients that this is a common side effect and that there's no cause to worry. A randomized trial of this system is ongoing at Memorial Sloan Kettering Cancer Center right now. For more information, you can see our publication in the proceedings of the AMIA Annual Symposium. And I'd also like to acknowledge the funding of the Patient-Centered Outcomes Research Institute, or PCORI, in a grant to Drs. Pusick and Temple. Thank you so much. I'd be happy to answer any questions about this project.